So if I have not had the pleasure of meeting you personally, my name is Renee Roederer. I'm the Senior Director of Programs and Community Care for the Epilepsy Foundation of Michigan. And so I also have this great pleasure of introducing our speakers for our next session. So I'm so glad that they will be joining us up here in a moment. This general session is sponsored by Henry Ford Health, and it's such an important topic, epilepsy and brain health, supporting cognitive function and well-being. So I get to introduce our wonderful folks. Dr. Wasade is an adult epileptologist at Henry Ford Comprehensive Epilepsy Center, and Dr. Jules Constantinou, known by many of our teens in the room as Dr. C, is a pediatric epileptologist at Henry Ford Comprehensive Epilepsy Center. So we're going to hear their presentations in just a moment and then conclude with 10 minutes for your questions. So I want you to be thinking about those questions throughout. So in just a moment, we're going to be inviting them to the stage. I think they'll be coming in, and that's wonderful. Please help me welcome to the stage Dr. Wasade and Dr. Jules Constantinou. Let's give it up.
Thank you, Renee. Thank you, everyone. It's so nice to see everyone this morning, and we are excited for the agenda ahead and learn together. And thank you, Marianne. It was an amazing, inspiring talk this morning. So we all learned a lot. So today we are going to talk about epilepsy, something that is not as visible. That comes along with it, and those are cognitive concerns that some people may have. By the end of this session, we hope that you'll walk away with some of these 4 key points. Understand why cognition and well-being matter so much in epilepsy. Recognize how seizures and EEG changes and anti-seizure medications, they affect the cognition. Identify the lifestyles and treatment strategies that help support brain health, and know when to screen for conditions that could be of concern and refer or seek help for neuropsychological care. So when we talk about seizures, again, when we talk about epilepsy, it's more than seizures that we treat. And neurocognitive functions, when we say about brain health is more of functions that include memory, processing, attention, and language. So these functions help us in daily activities. What we do, how we feel, how we do our daily work at school or at our employment, and how does it affect in our relationships. And seizures itself can manifest with many different conditions along with some triggers that include infections or any metabolic imbalance or just neurological condition itself, and that affects our cognition. So we know that if there are recurrent seizures, then that declines the memory, that can decline memory or executive functions. And as compared to general population, we have seen that people with epilepsy suffer 8 times more. That's a lot than other brain disorders like dementia, depression, and anxiety. So let's take a moment to look at cognition across lifespan. In childhood, we'll learn more about it from Dr. Constantinou. But this is the time when our brain develops and develops new connections, and there's a lot of learning of different skills, language functions that take place. And it's very vulnerable at that time when the seizures happen and disrupt the connectivity as well as the medications that can affect brain functions. And identifying that and applying strategies during those times does help. As we go on to adulthood, there are other things that happen. Attention, memory, executive functions get affected, and this all depends on different types of seizures and the treatment that are given at that time. And then as we proceed to elderly, more adult population, there is a different another aspect that comes into picture, and that is aging. Some things that happen with aging that includes memory problems, dementia, other comorbidities, and all these does affect brain health with time. And identifying all these, it's very important to separate all these together to see what could be the primary cause of memory concern. So again, we know epilepsy, it comes along with other comorbidities. When we say comorbidities, these are other conditions than seizure itself. And along with that is the memory complaint that we know, we just looked at, recall, processing, attention, language functions. And all these are affected, the effect is multifactorial. It depends on the seizure activity, the EEG type of activity. We see medications, sleep, and mood. And all these remain often under-recognized. So it's important to discuss with your care provider about how you feel, and because there are different categories of comorbidities that could be separated. There's physical comorbidity like sleep disorders that could play a part. Fatigue, migraines or headaches, the mental health illness like anxiety, depression, and cognitive impairments like, again, memory, attention, processing issues. So when we look at cognitive domains or neurocognitive domains or memory functions, in a neuropsychological test in those with epilepsy, there are 5 key elements that play a role, and that's for most of us. Executive functions, this is mostly the frontal lobe function that's responsible for planning, decision making, more of a flexibility, processing, attention. There's learning and memory, and this is more like how we take in the information, how we store the information. This is more about the recall, free recall or acute recall, how we have event recall. And then there is language function, how we process language is naming, finding words, having correct grammar, fluency, how we comprehend. The 4th part is social recognition. It's recognizing emotions of people or other person's perspective, what we call theory of mind, or our own insight, our own perspective about the condition and behavior. And then last but not the least are the perceptual motor functions, where we see how there is hand-eye coordination that affects in our day-to-day lives, visual perception and other motor coordination that we do little things like eating, cutting food, veggies, writing, driving. So these are 5 key important functions, just to lay a brief background on. So to begin with, we talk about seizures and seizure burden. So what is seizure burden? Seizure burden is the amount of seizure, the frequency of seizures, and the duration of seizures. The more they are, worse the cognitive outcomes, or more the effect on memory. And studies have shown that about 60 to 70% patients will have some amount of memory impairment in those who have recurrent seizures, and be that just language processing or little attention. Not all of them will display all, but some to some extent. And why does this happen then? This happens because there are structural changes, meaning there are conditions that the connections of the brain that get affected with time, and also the functional changes, meaning the connectivity. So the structural changes may be fine, the MRI may be fine, but the connectivity with timing and coordination of the brain activity, it gets affected. And affected by by epileptic seizures. So we can imagine it's so important to have these seizures under control that can lead to substantial improvement in cognitive functions. So we all know the test called EEG. It's the brainwave test. And even in a person who appears to be normal in those who have epilepsy, in between seizures, the EEG could show some abnormal activity that could disrupt the neuronal networks. When that happens, people may have some amount of mostly attention problem or functioning problem, and it is also what we call task dependent. That is more obvious at that time. And studies have shown that the more abnormal activity we see on the EEG, we do see more of attention problems or memory problems in those patients. So it's not like one size fits all for memory symptoms. Different conditions, different epilepsies will have different memory symptoms. In those, here are just some example. We know there's frontal lobe, parietal lobe, temporal lobe, and occipital lobe, just broadly. In particular, temporal lobe, which is one of the most common type of focal epilepsy, the primary functions are short-term memory or recalling brief recent events. So that's more of an episodic memory that people may have deficits. When it comes to frontal lobe, again, it's a command center of the brain where executive functions, decision making are the primary functions where that could get affected, and people may see that more in impulse control and some paranoias. So every lobe will have their own primary functions. If that is involved during seizures, maybe the seizures are starting from those areas, or maybe they are spreading to those areas, but they may get affected. And then there are generalized epilepsy. We know the discharges here could be all over both the sides, and typically there could be attention processing speed and learning difficulties. So identifying also the type of epilepsy, we can seek resources for memory symptoms accordingly. Now, epilepsy in older adults, I have to say, this is on rise, because epilepsy incidence itself is rising. More and more people have so it's not only the epilepsy or genetic or the primary epilepsies. With age, we see that people get diagnosed with strokes or head trauma or oftentimes brain tumor. And with that comes the irritability in the brain, and those do affect the incidence. So we see and here you can see that there are many risk factors that can affect an older population, be that diabetes, high blood pressure, cholesterol, heart problems, stroke. So there are a lot of vascular risk factors, along with the Alzheimer's, what mentions here, Alzheimer's pathology. It is a particular type of protein that gets deposited in the brain in situations of Alzheimer's dementia. So that we all know is common in the elderly, and so there's quite a few overlap in this group of patients who have epilepsy. So they may have many other risk factors. So this is very interesting and recent research. This is a prospective study of Framingham Heart Study. I think it's important to quote. This is a longitudinal follow-up. I think they started recruiting patients in 1948, and over decades, so next generation got recruited in the 1970s. So over decades, they followed up patients, and they have used the subcategories of patients in those who have dementia and those who have epilepsy. And they saw that over years and years that those who have dementia are twofold likely to develop epilepsy, and those who have epilepsy are also two times likely to develop dementia. So discussing any of these with your care provider is very important to see how we can seek help in getting that addressed as well. Then come the anti-seizure medications. We all know about this. So there are various factors that come into play when we talk about anti-seizure medications. Yes, they help reduce seizures, and because the seizures are reduced, memory symptoms get reduced. However, some of them do have side effects of memory that can affect memory. So a good balance of controlling seizures with the dose and managing adverse effect is important. Then why does this happen? Why do recurrent seizures cause this cognitive dysfunction? So with recurrent seizures, sometimes we also see what we call status epilepticus. Seizures are back to back. So that induces oxidative stress. What it is, it's sort of like a rusting in the nerve cells, and with that also alters the growth factors in the brain. It's called brain-derived neurotrophic factor, and it can cause neuronal death. And this is very common in hippocampal area, the temporal lobes that we know are the common short-term memory centers or language centers. So these areas are closely linked to cognitive dysfunction. So again, we end up blaming these to anti-seizure medications. Oftentimes the memory functions when there are a few anti-seizure medications on board, but we also should understand that having them on board is equally important because it helps control seizures. Now, along with that, we know that there could be underlying disease that can also affect memory symptoms, and this includes, say, had there been brain injury or any hypoxia, what we call low blood oxygenation, or any stroke or low blood flow to the brain, or some genetic disorders like Fragile X and Dravet syndrome, that themselves come with memory concern, with cognitive, developmental delay and cognitive delay, and that can affect cognitive functions in epilepsy. So it's very important to tease out the cause of cognitive dysfunction. Again, we know some of these, just laying it out there, sedation, slow processing, attention deficits. We have seen that with anti-seizure medications, in particular older ones. That's phenobarbital, benzodiazepines, topiramate to note. It can cause language and word finding and attention complaints, but again, on a higher dose, and it's all so much case-by-case basis that not all patients will have these side effects. So we do have neuromedications that could have more favorable outcomes, so it's important to discuss with your care provider. So another thing to note is polytherapy. When we say polytherapy, that means we are talking about many more medications, more than one medication. Monotherapy is one medication. So with more medication, there is higher risk of cognitive and behavioral side effects. So the aim for the care provider and even the patients is always to have monotherapy. However, we have to start a second medication or third medication to have better control. And so there should be a rational reason to add on these medications. It should be noted that these medications should have a complementary mechanism, because these medications act on different receptors and neurotransmitters. And because they have different actions, it's better to target the control by different medications. And that will also help in minimizing the side effects. So again, this is what we have seen briefly. Cognitive impairment could be affected by anti-seizure medications, just saw polytherapy. It could be different types of medication. It could be dosages that could affect. Then there could be psychiatric comorbidities like attention and depression that could affect memory. Then seizure burden we talked about, increase in frequency and duration of seizures, and the underlying etiology that, there could be something underlying like trauma, neurodegenerative condition, and just the brain structure or function itself may be not in sync, or there may be something concerning that can cause cognitive impairment. So what can we do? To begin with, let's talk about anti-seizure medication dosing, timing, and reversibility. Cognitive side effects could be adjusted, could improve by reducing dose if seizures are better controlled, changing the formulation, or switching another anti-seizure medication, or evening dosing, because then the side effects may happen when person is asleep, and daytime they feel more clear. Or even when they get started, consider slow titration of these medications, because there is always something called adjustment-related side effects that with time, if it is slow, the brain gets used to the medication, and it's easy to tolerate these medications. And it's important to avoid the peak sedating periods when people are at work or school. That can help with memory functions. So I have to put this slide because, we with medications, all side effects, and there is sometimes we cannot avoid but need to have some anti-seizure medications, multiple of them, polytherapy. Other than that, we know that there are other emerging treatments, like you may have heard VNS, vagus nerve stimulation, responsive nerve stimulation, that's RNS, and deep brain stimulation for epilepsy control, and that can reduce seizures. So by reducing seizures, we see that there is improvement in memory functions. And just to see if somebody is a candidate, you really have to talk with your care provider and undergo the testing to see that's a possibility. But again, with this, there's no side effect, systemic side effect, I should say, as you would with some other anti-seizure medications. So that's how it could help. Now, going on to lifestyle matters, some of these are basic, and we know, so sleep, nutrition, exercise, we all know, stress management, social engagement, substance use, they all influence cognition and seizure risk. But it's important to note that they're very low risk. It may be tough to implement them, but they are very low risk and high outcome that can help. Sleep, we all know, sleep deprivation lowers seizure threshold. Why? Because when there's sleep deprivation, or when there is light sleep and people don't go through deep stages of sleep, then the brain doesn't rest as well. And that can lower seizure threshold, that can worsen attention, memory, mood. Yesterday only I saw a patient and I learned something from them. I've been talking to them about this for the last 6 months. They said they're using this app or Mozart effect. It's 2 piano, D major. They're using this and they're putting that for an hour, and they fall asleep and they feel much more rested, they feel much more relaxed. There are no studies, but there are some anecdotal reports of that helping some people. And it's sort of like a non-invasive neuromodulation, I should say. It's just helping modulate the brain activity in becoming more synchronized for getting good sleep. Then we have to see if somebody is waking up with significant memory concern, increased daytime sleepiness, then obstructive sleep apnea is something they should talk to their provider for, because with CPAP and all, we have seen improvement in seizures and memory function. So again, sleep hygiene, bedtime routine, and that needs to be followed. And if there are any concerns for nocturnal seizure, then that needs to be assessed. So this is a long list of anti-seizure medications. Most of us may know that may have sleep as a side effect during the day. So these could be adjusted at night to help with sleep, at the same time to decrease daytime sleepiness, if that is a side effect for them. Nutrition and brain health. Food is brain fuel. Balanced diet, we all know. Whole grains, proteins, fresh fruits and veggies, so important. It's easy to get distracted by seeing yummy food, but it's very important. Nutritional deficiencies, again, very important. B12 and vitamin D, folate, these are considered to be brain vitamins. So it's good to get them checked by your care provider, and there are strategies to replace or supplement them depending on the number of the blood test. We know there's ketogenic diet. Yes, that could help in seizures, in controlling seizures. However, that may have some metabolic consideration, and that can affect memory symptoms. So it's easy to implement ketogenic diet in little kids. It's very tough to implement with all the discipline that's needed in adults. But that is something that you need to work with your care provider. Exercise, important for all of us. Some of these are so basic, but what happens if we don't exercise? Yes, we all know. But with good exercise, there's increased blood flow to the body, to the brain, increases attention, executive function, mood. This is for regular people, as well as it has shown. The studies, the randomized control studies, have shown its effect in those with epilepsy. Aerobic exercise is very common. And obviously, all these need to be under the supervision of a care provider. No swimming without supervision. Another point to note is strength training, in particular women with epilepsy, because with strength training, like dumbbells or like the easiest thing that you can do is important for bone health, because we are more likely to have low bone mass, osteopenia, osteoporosis. So it's very important to remember, do this, and implement in daily routine. And with this comes the neuroplasticity. Okay, just a few more slides. There's mental health, social engagement, cognition important, anxiety, depression, very common. We use psychological help, and social participation, cognitive stimulation is very important. Something to mention is these things also help support cognitive reserve. Now, what is cognitive reserve? This is a protective factor against future cognitive decline. So it's good to have all these social interaction and network, volunteer in activities, community activities. It's very important to do that. Last but not the least, substance use, recreational drug use. Sometimes we feel that some things are normal, but they do interact with anti-seizure medications, lower seizure threshold, worsen mood, sleep, and can worsen memory symptoms. So advise moderation. Now, with times, we know there are a lot of tools and apps. So just a few things to note. There are some reminder apps, calendar cues that people can use. Again, these are emerging tools, and just an adjunct to clinical care. Again, these are some strategies that people can use by using these apps, calendars on Google Calendar, Apple Calendar, maintain their seizure diary, logs, appointments. Just a few things to note on here: cognitive training and memory tools. I have personally tried this Lumosity app. It's amazing. I really enjoyed. This is for people who enjoy game-based training, but again, we know it's not a replacement meant for regular memory help. And also we have to make sure that people are aware of the consent, are aware of the data sharing, health-sensitive data sharing for this. There is Cognifit brain training app as well that could be used. But again, it should be a daily, short habit. Shouldn't be too overwhelming, causing fatigue and worsening and triggering seizures, and people should have a realistic expectation for this. We know there is occupational and academic support for people with epilepsy. There could be accommodations, extra time, quiet workplace, break periods, and it's important to coordinate with our occupational therapy or school teams for this. So if there's one thing I want to stress on is resilience. And Marianne, thank you for your talk, and it was so heartwarming and inspiring that people could understand how people can make a U-turn in their life. So it's so important. We have already seen to build resilience just helps us to bounce back and adapt and connect with the world back. So again, the goal, you work with your doctor to maintain a goal of good seizure control with medications, surgery, devices, and preserve cognitive health, quality of life, and emotional well-being. And doctors may use your feedback and also EEG and neuropsych testing for the further management. For you, it's important to set short goals that are achievable, manage stress, use social support, peer support groups, epilepsy foundations, support groups, very, very powerful networks that you can use to cope up with this condition. So just to wrap up, when we talk about epilepsy, it's not just seizures. It's about nurturing our whole brain and whole self. So that's all I want to say. Every step you take towards brain health is a step towards greater independence and well-being. Thank you.
Well, thank you, Dr. Wasade. That was wonderful. It's a hard act to follow. And it's always such a pleasure and an honor to be here. I want to say the loving arms of the Epilepsy Foundation, all our friends here, and the comfort and the family and village environment that you provide to help people with epilepsy. So thank you to the Epilepsy Foundation for all that they do. So I'm going to look at many of the same factors that Dr. Wasade told us about, and I'm going to look at them as they pertain to children. So I think in our lives we all have these moments, these lightning-like moments, which change the way we think. And one of them was when I was in Australia. I was a young buck. I just finished my training in Australia. I'd come back home after my fellowship at Boston, and Peter Silberstein, who was old and doddery like I am now, and I was like, what's he going to teach me? And we were walking across the tunnel to get to the parking lot one day, and he said, you know, Jules, it's more than just the seizures. You know, it's the learning issues, the mood issues, the stigma and that's what it's not just medication and seizures. And he was so right, and that changed me forever, you know. So thinking about the burden of childhood epilepsy and thinking beyond the seizures, and we know that children with epilepsy struggle with issues of cognition, with mood, and the social consequences of epilepsy. So overall intellectual ability in children with epilepsy is comparable to those without epilepsy. But children with epilepsy are at greater risk for learning problems and academic underachievement. And as Dr. Wasade told us, we struggle with deficits of attention, of memory, of executive functioning, and language. And those are the main domains that we think about. Mood comorbidities are significantly more common in children with epilepsy, and we can think about depression, anxiety, ADHD, which is a little bit of a pet topic for me because I have a little bit of it, which wasn't recognized, and conduct disorders. So these are the things that we often think about. So there's a complex interaction between the epilepsy, the cognition, the psychological symptoms, medication, and things like seizure frequency, age at onset of the epilepsy. So epilepsy beginning at a young age is often associated with more cognitive comorbidities. Whether or not there's an underlying structural brain abnormality, the effects of anti-seizure medication, psychosocial stresses, those all go into the big potpourri which affect a particular child. So 50% of children with epilepsy have some form of learning difference, and I'm not going to call it a disorder or a disability, because if we anticipate it, we can intervene and we can help the children. You know, one of the things that I have to teach myself as well is a lot of times when we're approaching children, we focus on the negatives rather than the positives. And that's a difficult thing to do, but something that we should do all the time. So the differences can range from subtle differences to severe disability. And we know that about a quarter of children with epilepsy will have a cognitive impairment, which can vary from mild to severe. So epilepsy typically affects these domains: speech and language, attention, memory and executive functioning, and processing, which is really part of executive functioning. So that they're interrelated, they're integral to success in school and beyond. And early recognition of problems in any of these areas is critical so that parents and teachers can take the appropriate steps to help children achieve their learning goals. So what are the contributing factors? And Dr. Wasade told us about those which contribute to the cognitive challenges. Firstly is the seizure activity, right? Seizures disrupt normal brain function, the neural connection, and even the interictal, the IEDs, the epileptiform activity that doesn't quite mount up to a seizure that can affect our learning and condition. The underlying cause, so if there's a structural brain anomaly, if there's a genetic anomaly, we only got 15 minutes left. We only started 5 minutes ago. We've got 30 minutes. So, yeah. So the underlying causes, so add another 10 minutes. So the brain disorder or genetic disorder, medication side effects can contribute to learning issues, psychosocial factors, worry, anxiety, self-esteem, and then comorbid conditions. So children with epilepsy have a higher likelihood of ADHD, autistic spectrum disorder. So let's break down these cognitive challenges. We have challenges with attention and concentration. So ADHD, the children struggle with sustaining focus, they're distracted. Absence seizures can be mistaken for daydreaming, and vice versa. Daydreaming can be mistaken for absence seizures. Language and speech, and especially with left hemisphere seizure foci, the children may have trouble understanding language, expressing ideas, finding words. Executive functioning is and that's planning, persistence, organization, self-regulation, impulsivity, problem solving, and then processing information. So children may need more time to process information, complex tasks. So when speech and language are impaired, there's learning and socialization are greatly impaired. And it seems like we have a time issue, so I may not go. So, you know, if there is a language disorder, you need to work around it, right? Kids will a hands-on approach, speak clearly, slowly, be specific, use your non-verbal communication, lots of visual cues, repeat and rephrase, engage the child in conversation, encourage learning new words, read to the child every day. We spend too much time on these things. Use visual prompts and play word games. So these are things just to encourage building of language. So attention, ADHD is very common in children with epilepsy. 30-40% of children with epilepsy have an ADHD. Sometimes it's not always ADHD. Sometimes it's the more daydreamy, inattentive type of ADD that we call ADHD, predominantly inattentive. So in the classroom, we have trouble with distractibility, staying focused. We need redirection. But the main issue relates to executive functioning, starting something, staying with it, finishing it. We have lots of wonderful ideas, but how do I plan? How do I sequence? So we get sidetracked, we shift from activity to activity, and it takes us longer to finish. And organization, you know, oh, my child's lazy because he doesn't turn in his work or doesn't want to finish his work, and recognizing that ADD is very common. Some medications can increase attentional difficulties. Depakote is famous for that. And then the other thing, of course, is that there's this mythology, which is often even child psychiatrists, pediatricians have imagined that a medication for ADD will lower your seizure threshold. And now I've never seen that. It's very rare. So I think just because you have epilepsy, that's not a contraindication to trial of a stimulant medication if we think it's necessary. So what are the strategies? Sitting in front of the class, small group, breaks, extra time for tests and assignments, organizational aids for planners, especially for kids with milder ADD as they advance into high school and the school curriculum expands. What is executive function? And really that executive function is the set of mental skills that allows individuals to plan, organize, manage time, focus attention. So it's really our CEO, you know. How do we organize, achieve our goals, stop from going off on a tangent and finishing what we want to do. So the key components are working memory, cognitive flexibility, and inhibitory control. And the way I explain working memory to my families is, if I'm driving around the street and someone nicks in front of me, well, I know a bunch of words that my mother didn't teach me. You know, and I might say, well, you know, but what I say to myself is, you know, these people, I don't know who they are, I don't know where they're coming from, maybe they have a gun, maybe I should just ignore it, maybe I should look just straight ahead. And that's hard to do, especially for kids with a more impulsive type of ADHD. Where's that situation coming from? What are my choices of action? And, you know, so we have to appreciate that. So children struggle with the impulse control, the persistence, the transitions part. That's also an important part of executive functioning. So executive function allows us to consider more than one option, choose one, and then create a plan of action based on past experience. It's critical to a child's ability to success and to use other intellectual abilities. And if epilepsy has compromised executive functioning, a child whose basic skills are intact may struggle in the classroom and in communication with each other. And again, the executive functioning difficulty becomes more pronounced as we get older. So how do we help? We structure, that's very important, set up routines. Habitual activities require less active processing, are less likely to be forgotten. plan ahead, set small, achievable goals. I often say computers are wonderful for kids with executive functioning issues. They give you that external framework to maintain a task. Advance warning, and memory difficulties. Of course, 70% of children with epilepsy report memory difficulties. As Dr. Wasade said, it's more common in kids with temporal lobe epilepsy. The executive functioning difficulty is more common in children with frontal lobe epilepsies. So it's a complex operation, and is affected by other cognitive processes such as attention, effort, self-monitoring, speed of information processing. So children may lose memories before a seizure because the brain doesn't store them. After a seizure, confusion and fatigue can interfere with the formation of memories, and interictal discharges can disrupt formation and retrieval of memories. So make topics meaningful to the student, use different learning styles, teach information in small chunks, carry over themes of learning from one environment to the other. What's going on at school, sort of recapitulated at home, in therapy, in speech, teach mnemonics, visual aids, and allow the student time to review. So, what are our strategies? Educational supports are critical. You need an on-site school system and a village to help your child. So you want open communication between parents, teachers, and medical professionals. When do we think about neuropsychology evaluation? And we have wonderful neuropsychologists in our system, and we can do a formal evaluation to look at cognitive strengths, cognitive weaknesses. How do we tailor a support plan? You all know about IEP plans and 504 plans. According to, eligible children are legally entitled to special education services and classroom accommodations. And if you struggle getting those, the Epilepsy Foundation can help you. Classroom accommodations, again, sitting at the front of the class, breaks, extra time, resource help in areas of academic difficulty, for kids that struggle with that organization piece, an extra set of books, sending missed work home, being allowed to email your homework in instead of carrying it in your knapsack or bag. And it's a multidisciplinary approach. So we have neurologists, psychologists, speech and language therapists, social workers, educators, all are part of the village to help a child do his best, be his best. Home support, simplify in structure, use visual aids, short instructions, and a calm, low distractibility environment to help with focus. One-on-one support, especially for kids with executive functioning issues, to help starting, completing tasks, follow through. Teach your child organization strategies, a planner, provide modeling of organizational skills, maybe a little calendar chart on the fridge at home, and encourage brain-boosting activities. And that's not the iPad, that's things like puzzles and reading and playing outside, exercise to stimulate the brain and improve neuroplasticity. Learning does not stop at the end of the school day. Parents have a huge impact on child's development. It's helpful to meet with the teachers and the school staff regularly, and the parents can present medical information about their child to help educators better understand the child's needs. So that's looking at the cognitive issues, and we think, again, just the bullet points. Think about language, think about attention, think about executive function, think about memory. How can we help with those issues? I want to talk a little about stigma. And children with epilepsy are vulnerable to stigma. And I always ask the kids about this at Camp Discovery. And we have enacted stigma. That's what other people do to us because they perceive us as other or different. That can be things like exclusion, teasing, harassing, bullying. You know, your teacher not allowing you to participate in a group activity because you have epilepsy, or go on a field trip on the school bus. That's stigma, right? And then it's felt stigma, you know. If I feel lonely or powerless or shame or less than, that's felt stigma. So there are social consequences: low self-esteem, confidence, difficulty making friends, social exclusion, difficulty with transitions, fears of disclosure. You know, going to a new school and telling people that I have epilepsy, that's a big thing, right? 40% of children with epilepsy develop anxiety compared to 9% of children without, so a lot more common. And it's anticipatory worry. Maybe I'll have a seizure. Social phobia, fear of seizures in public, embarrassment. And 30% of children with epilepsy also have depression, which is under-recognized and under-treated. And it's harder to pick up mood disorders in young children because we don't have the words. So we're going to isolate, sick in our bedroom. We're going to have little hissy fits, meltdowns, acting out behaviors. And then these are just some of the symptoms of clingy, stomach aches, negative thoughts, unexplained crying, quick to upset or anger, panic attacks. So what strategies can we use to support mental health and emotional well-being in children with epilepsy? Encourage open dialogue. Create a safe environment where your child feels comfortable discussing fears and worries about epilepsy without judgment, you know? Be honest and age appropriate. So be honest, simple, age appropriate information about the condition. And understanding epilepsy helps reduce fears and misconceptions that the children might develop on their own. Acknowledge feelings, validate emotions. You look worried now, are you worried now? It's okay to feel sad, it's okay to feel anxious, it's, you know. And model healthy coping. Share your own feelings, how you manage stress, like going for a walk, listening to music, and then this teaches by example. Promote social activity. Encourage participation in age-appropriate hobbies, social events like play dates or camp, and we have a wonderful camp for children with epilepsy, Camp Discovery at North Star Reach, and that's really a wonderful forum. It's a place where kids can meet other kids with epilepsy, learn about the epilepsy. We have an Ask the Doctor, Ask the Doctor session so they can ask questions, they do lots of activities. They're not stigmatized. You know, I can't go swimming or rock climbing and all sorts. Well, we used to have rock climbing, not anymore, but maybe one day, I don't know. And again, focus on strengths. Nurture self-esteem by highlighting strengths and what they can do rather than focusing on limitations. Encourage responsibility and self-management. Involve children in their own epilepsy care. As we become teenagers, that's when transition begins, right? And what type of epilepsy do we have? What type of seizures do we have? What medications do we take? What can we do to remember to take medication? And this builds a sense of control and competence. Routines that Dr. Wasade told us about: balanced diet, regular sleep schedule, consistent daily routines. Educate others so that other adults in their lives know what to do if a seizure occurs, and this allows for greater flexibility and independence. Connect with peers. We talked about support groups, camps, and what I hear is that a lot of the kids at camp, once they leave camp, they form these little networks and they stay in touch with each other. So it's a lifelong social connection for them. Utilize your resources. You're not alone. We have the Epilepsy Foundation, you have your social workers, you have counselors, you have your neurologist. So yes, utilize us. Come to us with your concerns. Consider therapy, and I think especially for kids with anxiety, depression, kids that are feeling different. Andrea, I don't know if Andrea's here yet, the psychologist, she's wonderful at, getting into helping the kids. And then parents, don't forget yourselves, right? Self-care for mums and dads, because we don't want you to get caregiver burnout, because you're no use to anybody if you're burnt out, right? So get that me time. It's important. And there's just a picture of the Epilepsy Foundation. That's at North Star Reach. There's Shannon right in the front. Okay. And that's all the kids. I think we're saying goodbye at the end of the camp. And this is the old camp in Kalamazoo. They're bonding there, I think, something like that. And then that's the village. There's Kyle, Stephanie, Kim. So when do you seek professional help for mood disorders? Be alert for changes in behavior and mood, withdrawal for friends, wanting to be by myself, irritability, learning problems sometimes. We can't concentrate at school, negative state, I don't want to be here, trouble sleeping, and seek professional help with symptoms that are persistent or severe. So, as we said, comorbidities interfere with academic performance, social integration, emotional development, and supporting cognitive and learning, attentional and emotional differences is an essential component of care for the whole child. And our goal is to enable children with epilepsy to reach their best potential in terms of learning, socialization, communication, and enjoyment of life. And all these consequences of epilepsy play a major role in school success and determining long-term success educationally and occupationally and socially into adulthood. So I think it's, mums and dads, you have a lot to think about, but I hope this helps.
Well, that was absolutely wonderful. And a few affirmations. I just want to thank you. It's so clear. You are both wonderful doctors, but also wonderful teachers. So let's give them another round of applause. Yeah. Wonderful. And also, it's very clear. You care so much about the whole person and the whole community, and that really means a lot to us. It is time for your questions, which is really exciting, and we'll take 10 minutes for those, and then we'll have a 10-minute break. So what we are going to do is, if you have a question, you can raise your hand. Someone will come to you with a microphone, and we're going to wait to make sure we have the microphone so we can hear everybody, and we can also hear online. But please try to keep your question brief so we can get to as many as possible. Who has that first question? Okay. Great, right up here. And you can also say your first name if you'd like. It'd be great. Okay.
So my name is Natalie, and I had a question about the memory part for epilepsy because I have a hard time with my memory. So my seizures are controlled, but could you still have memory issues even if they are controlled, or no?
Good question. You can use these mics too. Can you hear me? Well, I think we turn it on, I think. Testing my ability to turn things on. Okay, there we go. Or you could pass it back and forth too if you want to use that. Okay.
Yeah. Well, I I'm sorry to hear this. It also depends on the number of medications and what medications you're using right now. So you may want to discuss with your doctor if, also we need to correlate, are your memory functions starting when your seizures started? And are they worsening since then? It's great that the seizures are under control, but medications could play a part in it. However, you may want to check with your doctor and they may want to send you for neuropsychological testing.
All right, thank you.
Thank you so much. Thank you. Okay, our next question. Great.
I was curious. I've had epilepsy for 62 years. How many times throughout life in that time has the type of seizure been changed?
Like
What
the
they call it.
terminology? Yeah.
Terminology.
Changes in terminology for seizure types.
Oh.
Like how often has that happened maybe over the years?
Yeah, so I think the first terminology came in 1970s. Then it was just grand mal, petit mal. Then 1980s, early 1990s, we have those complex partial seizures, focal seizures. And last 10 years, they have changed over to what we are calling focal seizures. So it's just a play of words. I tell my patients, it all depends on what the EEG shows and what you experience. It's just for doctors to understand the terminology.
Good. Great, thank you. Okay, another
I
question.
can
Oh, please.
perhaps have a more cynical view of why the names keep changing. You have a lot of people on committees who've got nothing else to do. But what should we call complex partial seizures? Maybe we should call them focal.
Yeah.
Most recent is the proposal to change that focal seizure with impaired awareness to focal seizure with impaired consciousness. So, again, it's
Yeah.
play of words.
Changing, yeah,
Yeah.
wonderful. Okay, another question, please. Yes, Sandy.
Hello, my name is Sandy. Our daughter is currently on several seizure medications. Her seizures have been controlled for 7 years, but now as a young adult, she is struggling with anxiety, depression, and some of her doctors are suggesting that she go on antidepressant medications. Could it be the medication she's currently on that need to be adjusted as opposed to throwing more medications at her to now deal with this side effect?
Yeah, that's always, many issues can contribute to mood disorders. How old's your daughter, did you say? 26. So I think, there's many issues that could contribute to that. I think a lot of the young adults that I see with epilepsy, I mean, they might say, well, my life is so different, so part of that could be social factors. Part of it could be, there's an organic component. It's the way the brain, the brain manifests anxiety and mood disorders. So it's not necessarily situational, but it's medications can contribute to anxiety and depression. So lots of different things. Have you tried therapy, cognitive behavioral therapy? You've tried that. So you want to make sure you have a therapist that understands epilepsy as well, because sometimes you'll see a therapist, you've got nothing to worry about,
Sure.
but and I think maybe we have some connections, and it could be medications. How many meds is she on? 3. So that's always hard, because what I sometimes say, the most difficult decisions people make are starting seizure medication and then stopping seizure medication. That's always a tough decision, because you can never promise that you're going to stay seizure-free. So maybe sometimes the medications can contribute to depression, and there's some medications which are more likely to do that. So, think about which medications would it be worth trying to take away one of those medications, understanding that there might be a risk of seizures. And then, medications often do help people. So I think it's not an absolute no to ever thinking about medication, but you want to do your due diligence, and I think counseling and looking at the seizure meds, and then, could there be an option for medication?
Thank you. I would also just like to share that we, the Epilepsy Foundation of Michigan, have trained therapists about epilepsy and functional seizures and associated mental health conditions. And on our website, if you search, you can find it on our website, but you can also just search for Therapy Epilepsy Foundation of Michigan. You will see a list of those therapists who are available to you. We have time for one and maybe two questions, but definitely one. So we'll go over here. Thank you.
Hi, my name is Suzanne, and I was wondering about the memory. I had an experience where sepsis went throughout my whole body, and I was in a coma for 3 to 4 weeks. I don't remember my wedding. I don't remember my kids, teenage years. My short-term memory is shot. Is there ever a chance where you can get some memories back? I'm on medication for memory also, but is there ever a chance where those memories would come back, or are they just lost?
How long ago was that?
I got sepsis in 2023.
Recently, okay. Yeah, well, I'm sorry that happened. So we end up seeing this type of these type of symptoms, but with good. Have you been to neuropsychological evaluation again? I'm saying because it is so important to understand. Yes. Yeah. So. There are chances that it may not be. There is so much neuroplasticity in the brain. So with all that lifestyle, good sleep and following up with a therapist who can also help in cognitive behavior therapy is something probably that would help in this condition. But the more we keep on using our brain, better it is for the brain to be active in this condition. So. Medications do play a part, but they are needed in this case. So it may be challenging to adjust those.
Yeah, thank you. In a moment, we are about to take a break, but I want you to know that in the back part of the room, we have a table for Henry Ford Comprehensive Epilepsy Center. I know you have your passports today, so if you have a question, you can still go and ask. But please join me in saying thank you to our physicians. Thank you.